Right. Let's talk about something I bet you hardly ever think about, your kidneys. I know, they're not exactly the life of the party, but trust me, these little bean-shaped organs about the size of your fist are absolute legends when it comes to keeping you ticking. Nestled just below your ribcage on either side of your spine, your kidneys are basically your body's own filtration system. Every minute, they quietly filter around half a cup of blood, pulling out waste and excess fluids, which then leave as urine. That's not just clever, it's vital. Without them, toxins and rubbish would pile up faster than dirty dishes on a Monday morning. But wait, there's more. Your kidneys are not just glorified water filters. They're fluid and electrolyte experts, keeping levels of sodium, potassium, calcium, and phosphorus in check. Why does this matter? Well, without the right balance, your nerves, muscles, and tissues would be in for a rough time. Ever wonder why blood pressure is such a big deal? Your kidneys are at the center of it. By releasing special hormones, they help widen or tighten your blood vessels, keeping your blood pressure in the Goldilocks zone, not too high, not too low. They even give your bones a helping hand by activating vitamin D, which helps your body absorb calcium and keeps those bones nice and strong. And if that wasn't enough, they crank out a hormone called erythropoietin to tell your bone marrow when it's time to make more red blood cells. Pretty impressive, right? But here's the catch. Kidneys can run into trouble. Chronic kidney disease, or CKD, is sneaky. You might not notice anything's wrong until a lot of damage has been done. Early on, it's a silent operator, so it's often picked up during routine blood or urine tests. When symptoms do show up, you might spot swelling in your ankles, feet, or hands. Thanks to fluid your kidneys couldn't shift. There's also fatigue, nausea, changes in your wee, and even high blood pressure that just won't budge. Some people notice blood or foam in their urine, dry, itchy skin, muscle cramps, or even shortness of breath if fluid backs up into the lungs. So, who's more at risk? If you've got diabetes, high blood pressure, heart disease, obesity, a family history of kidney issues, or you use certain medications long-term, you'll want to keep a closer eye on your kidneys. Let's not forget kidney stones, painful little blighters. These form when minerals and salts clump together inside your kidneys. Small stones might pass naturally, painful but doable with lots of water and sometimes medication. For the stubborn ones, doctors might use sound waves, lasers, or even a tiny scope through a small incision to break them up. Yep, modern medicine is amazing. And here's something truly life-changing: kidney donation. If you've got 2 healthy kidneys, you can actually donate one to save someone's life. The process is carefully managed, with lots of tests and most surgeries done using minimally invasive techniques. Donors need to be over 18, in tip-top health, and with no major health conditions. It's an incredible gift. So, how do you keep your kidneys happy? Start with your diet. Keep your salt in check and skip the overly processed stuff. Fresh foods and herbs